Anyone, inshallah, would like to start? So we're going to do the same thing. So please use the mics. You have the mics to the end. What? Houston, inshallah. September 23rd. تفضل. أو 22nd. That weekend, yeah. That weekend. No, we're going to be sending a follow-up email, but it's going to be that weekend. Yeah, it's going to be the September 22nd. The Sheikh is correcting me, Jazakallah khair. September 22nd weekend. Okay. تفضل Sheikh Yasser.
Assalamu alaikum wa rahmatullah. Regarding this topic, one of the issues that I face where I'm from Sacramento, is many times I get a phone call from family where they have a loved one that's on life support, and they're trying to figure out when to pull the plug. What I've been doing for years is at the mercy of ulama. There are also medical doctors throughout the country. We have a conference call, and then that's been the MO for me. I would request if there's a possibility of presenting a paper on this matter, so that we can use this as a rule, inshallah.
Allah yajzik khair, barak fik. Anyone, do we have a mic, Sheikh Darsani, for the second, on the other end? I don't see a mic. Broke? Oh, subhanAllah. Okay, so we're taking the questions only on one side, or the comments on one side. So please go ahead, Sheikh.
Assalamu alaikum wa rahmatullah. I'm Ahmed Al-Amin, the Imam of the Indianapolis Muslim Community Association. What I would like to see being discussed next year is how to react to pandemics. I hope this is the last pandemic we will witness, but it's very important for us as masajids and imams to have some sort of standardized way to react to masjid, whether it is related to closing the masjid, shutting down the masajids, and having multiple jum'ahs, social distancing, and also medical things related to that aspect, so that we can refer to these fatwas, inshallah, or these research in order to make informed decision.
Next.
Assalamu alaikum. So I believe one of the issues that's not often discussed in the Muslim conferences is the machine learning for healthcare.
I'm sorry, can you, one quick note, please. We really do not allow kids less than 16 years old to be in the lecture hall, so we appreciate if everybody observe that. Go ahead.
Yes, so the suggestion is machine learning for healthcare, basically using predictions of machines on how to treat and how to diagnose people with different diseases. And I also would like to offer my services. I can help with the research as well, inshallah.
Forgive me, but I did not understand yet.
So machine learning or artificial intelligence or deep learning for healthcare.
Okay, so machine learning for the, okay. Before we proceed, inshallah, I just would like to introduce the panel we have on the stage. We are very honored to have members of the AMJA General Council present with us today. So we have Dr. Muhammad Akram Nadwi, mashallah, he's visiting us from Britain. We have Dr. Mohammad Al Zuhaili. We have Dr. Maan Al Qudah, Dr. Salah Al Sawy, Dr. Waleed Meneese, and Dr. Waleed Basyouni. We have also Dr. Jamal Zarabozo, but he left early today. So just wanted to make sure that we introduce our esteemed scholars. Yes, Sheikh.
Assalamu alaikum wa rahmatullahi wa barakatuh. My humble recommendation or suggestion would be about...
May I interrupt you for a second?
Sure.
Yes, thank you.
About our masajid, we in some cases have blood drives and we donate blood to these blood banks, and many times they're selling the blood, they're making a business out of it. Our community members ask about being paid to donate blood or blood plasma. So maybe a topic along those lines would help, inshallah, serve our community. Jazakumullah khair.
Very nice. So we had 4 of the Imams. Inshallah, we're going to take one from the sisters now.
Assalamu alaikum. I'd be really curious and interested to hear what the discussion is regarding active and passive euthanasia by medical professionals.
Can you repeat that and make the mic closer to you?
Sure. So active and passive euthanasia by healthcare professionals. So withholding or giving treatment that's to basically end life if a person is going through some kind of illness that's already that they don't want treatment for.
Okay.
ورحمة الله وبركاته. من الأشياء الجديدة التي تحتاج إلى نقاش حقيقة، مر علي موقف قد يمر على كثير من الأئمة في قادم الأيام، أن شاب دخل الإسلام واحتضنه الناس وكبروا بالطريقة المتعارف عليها في مساجدنا، وفجأة طلع زملائه المسلمون الذين يدرسون معه في نفس المدرسة يقولون أنه بنت وليس ولد، أنه امرأة وليس رجل، مع أن الملامح كلها رجل، يعني يبدو أنه مر بالتغيرات المتعارف عليها. فمسألة مثل هذه ما أدري هل تؤجل إلى ذلك الحين وتناقش بتفاصيلها؟ جزاكم الله خير.
نعم. Yes, تفضل شيخ أحمد.
السلام عليكم ورحمة الله وبركاته. جزاكم الله خيرا وبارك الله سعيكم وجهودكم. من الموضوعات التي أظن أننا نحتاج إليها كأئمة عندما نتكلم أو نسأل من الدكاترة والمتخصصين في المجالات الطبية مجال التلقيح الصناعي والمشاكل التي ينبغي أن ينتبه إليها الأئمة، ليس حكما عاما فقط. يعني نريد من الإخوة الذين يقومون بالبحوث أن يطلعونا على الأمور التي تخفى على الأئمة في هذا الجانب، حتى نكون على حذر من الفتوى بغير علم أو الوقوع فيما حرم الله سبحانه وتعالى. الأمر الثاني التعديلات الوراثية أو ما يحصل من التلاعب بالجينات الوراثية، أيضا دخل فيها أمور تحل وأمور تحرم. فنحن أيضا نريد أن يعني نتعلم في هذه الأشياء الجديد وآخر الأمور التي تحدث في هذا الجانب أو هذا المجال، حتى نستطيع أن نساعد الدكاترة على اتخاذ القرارات، وفي نفس الوقت نحذر الكوميونتي والمسلمين من الوقوع في شيء يغضب الله سبحانه وتعالى. جزاكم الله خير.
الله يجزيك خير ويبارك فيك. Next إن شاء الله.
Assalamu alaikum wa rahmatullah. Madhar Mahmoud from Peoria, Illinois. I know this aspect has been discussed classically in between when, if there's a pandemic or a sickness, and then there's a dispute between the ulama and the atibba, who gets the preference and who gets basically the say. But I think it should be given exposure once again. So basically, the topic would be along the lines of when there is a dispute between scholars and the doctors, who to prefer. Another aspect, I know one of the mashayikh highlighted we should speak to issues about pandemics. But one of the branched out issues that comes to mind when we speak about pandemics is the aspect of possibly socially distancing oneself in salah. I know many of my contemporaries and colleagues, even myself, we wrote a few articles on socially distancing during the pandemic, and from around the world we get called names and refuted, and fingers are pointed at us in the most negative ways. So maybe we should give exposure to this as well in our discussions, what to do with matters like socially distancing within pandemics, etc. Barakallahu feekum.
الله يجزيك خير ويبارك فيك. تفضل شيخ.
السلام عليكم ورحمة الله. Muhammad Amir. I work as a chaplain in the State Prison of California. And this is my first time being honored, to come to the AMJA conference. And may Allah increase your knowledge. May Allah make everyone benefit out from this conference, inshallah. ونفع الله بكم عموم المسلمين. Just, because I've been working in the prison system for 3 years now, and we need to really try to focus on the rights of the Muslim inmates, whether men or women. This is very important for us. So I don't know if AMJA, they are going to really, focus on this sector, because we have a potential brothers and sisters who really needs all our attention, and we need to take it seriously because they are actually falling behind, and some of them they are relapsing, and some of them they exiting out of Islam, and we need really to put all our efforts, inshallah, as ulama, as imams, as scholars, so we can try to enhance, the process of, supporting our brothers and sisters as much as we can. It's a very tough job, and no one can do it only by him or herself. I get less volunteers, and I can't emphasize the importance of volunteership in this matter. The inmates, they need to be educated. They need to know what is the necessity of religion to be added to them all the time. So, Jazakumullahu khairan for trying to bring this, in the most highest level, inshallah. Jazakumullahu khairan.
Jazakallah khair.
Sheikh Sadeq, Akhi al-Karim, since you are in the field itself, I think it's going to be very, very crucial to put some questions together when it comes to the inmate rights. What are the actual scenarios like on the floor? No, maybe not now. I mean, if you can just put them together, what are the areas of concern? What are the questions that you have in mind regarding inmates? For example, breaking their fast in the month of Ramadan, having sahur, praying Salatul Al-Jum'ah, doing ghusl, whatever the contemporary issue might be. If you put them together, like a list of questions, that will be very helpful. Jazakallah.
Jazakallah khair. Next, Sheikh Rifat, تفضل.
السلام عليكم. بس القضية هي الأساسية اللي ربما ذات شجون لما بنحكي عنها الآن، خصوصا في كندا، اللي عايشين في كندا، اللي تجبر كثير من الأسر أنها تفكر في الهجرة العكسية، وهي مسألة التحول الجنسي وإعطاء الأطفال دون سن البلوغ حق اختيار الجندر أو تغيير أنفسهم. من الناحية الطبية طبعا احنا عارفين أنه الأمر أصبح حركة المثليين حاليا في العالم LGBT community is attacking the Muslim community really widely. فإن شاء الله نتمنى أن يكون في الاجتماع القادم بإذن الله تعالى، المؤتمر القادم يتناول هذه المسائل من الناحية الفقهية، وكيف احنا كأئمة علماء نرد على هذه الظاهرة الكبيرة التي تحدث في العالم الآن. جزاك الله خير.
The sake of time, we are talking about topics related to next year, which is medical field. So it's not an open microphone for suggesting general topics. It is a topic related to medical field. So that's a good one about changing genders and stuff like that. That's good. And if it's been mentioned, there's no need for repeating any, unless there is a specific point you want to pick. Jazakumullah khair.
تفضل يا شيخ.
Assalamu alaikum wa rahmatullahi wa barakallahu feekum jami'an. I think some issues that we're facing in the medical field specifically is end-of-life cases. Someone's on life support, and they call the imam and they say, we're being pressured to pull the plug on my mom or my dad. What do we do, Sheikh? So understanding the dawabit in this end-of-life area. Another area is organ donation. I'm going to the driver's license and they're asking, can I be an organ donor? Can I accept organ donation? So two different type of areas. And then like medical marijuana and substances that are newer. So the difference between recreational marijuana as opposed to medical marijuana. There's a new one coming out, mushrooms. These types of things, what are the dawabit, or where can these be used for medical purposes and recreationally? How do we understand these issues? Barakallahu feek.
Sisters, do we have
Yes, Assalamu alaikum. Sorry, I apologize. I had to step out for a minute, so if something has been said already, please excuse me. So a few that I have, like talking about abortion, adoption, contraception, prenatal genetic testing.
Can you just let me catch up, Michelle?
Oh, sorry. So first one is like abortion and the issues surrounding that, issues surrounding contraception, adoption, so like adoptions and related to like medical aspects of it, prenatal genetic testing, so in-womb genetic testing, and cosmetic procedures like plastic surgeries that have both like a cosmetic and a medical component. And I think that's all.
جزاكم الله خير. تفضل شيخ.
Assalamu alaikum. Ahmed Badir, volunteer in Umar Islamic Center in Connecticut. My question is in relation to genetic diseases, family genetic diseases, and when it comes to marriage, what is the ruling of Islam in checking if someone is coming to marry your daughter or your son is marrying someone, and we know that they have some genetic or our family have some genetic disease, that if they marry from the same say people with the same genetic disease, they may have that actual disease. They may be carrying, so they have the trait, but they don't have the actual disease. But if they marry some other people from the same with the same disease, they may with the same trait, they may have the disease. What is the ruling of Islam?
تفضل يا شيخ.
السلام عليكم ورحمة الله وبركاته. محمد علي با من منفيس. أولا مثلا حكم النجاسات والكحول والخنزير في الأدوية وكذلك في المسكنات، ما هي الحد؟ Secondly, beauty surgery for women. Sometimes we try to do this.
So نجاسات الكحول الخنزير in pertaining of the medicine.
Yes.
In the medicine.
في الدواء وكذلك في المسكنات أحيانا.
في الدواء عامة نعم.
ثانيا like beauty surgery for women. Like مثلا المرأة تريد تتجمل مثلا تكبر مثلا يعني تبرع وكذا يسوون يعني surgery. ما حكم ذلك مثلا لو كان رجلا ثم معاي ولا ثم ما حكم مثلا اخذ الدين لدراسه الطب، لانه نعرف انه غالي جدا، فلو انسان يريد يدرس الطب يجوز له شرعا مثلا ياخذ الدين لذلك او لا؟
الدين بانترست يعني
لدراسه الطب يعني خاصه. ذكرت معرفة مثلا جنس الجنين، فمثلا لو الإنسان سئل ماذا يريد أن يفعل مثلا يختار ذكر أو أنثى في بعض الحالات. بارك الله فيك.
فيك بارك. تفضل يا شيخ.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على النبي المصطفى وعلى آله وأصحابه وسلم تسليما كثيرا. أريد منكم أن تقولوا جميعا الحمد لله. والله قولوا الحمد لله. لئن شكرتم لأزيدنكم. وقد زادكم الله خيرات كثيرة ومشاريع كثيرة. جئتكم من قبل هذا المؤتمر، بين ذلك وبين هذا سنين، وقد رأيت أشياء كثيرة متطورة ومتطورة. فقولوا الحمد لله.
الحمد لله.
اعملوا فسيرى الله عملكم ورسوله والمؤمنون. وبالله تعالى التوفيق. جئتكم من أفريقيا لأشهد منافع لنا جميعا، وأحبكم في الله.
حبك الله.
أحبكم في الله. الجد في الجد والحرمان في الكسل. اعملوا فسيرى الله عملكم ورسوله والمؤمنون. اعتبروا بالأمس وقارنوه باليوم يتبين الفرق. والسلام عليكم ورحمة الله.
الله يجزيك خير، بارك الله فيك.
مفتي سيراليون.
تفضل يا شيخ.
مفتي سيراليون.
السلام عليكم. جزاكم خير. Sheikh, alhamdulillah, for your sacrifice and your effort to be with us in this effort to share the ilm of al-Din in various matters of contemporary issues. One concern that we are having in South Carolina and perhaps in other states is the matter relating to autopsies after the death of Muslims. And in our state, it seems as though it has to be an act of the state legislature to bring about a change. That if we haven't discussed that issue before, perhaps that could be an issue that we can address collectively for the benefit of the entire community. Jazakumullah khairan. Assalamu alaikum.
الله يجزيك خير.
السلام عليكم ورحمة الله وبركاته. إن شاء الله كان يعني نفس السؤال قريب من السؤال الأخ في عمليات التجميل، ولكن عمليات التجميل خصوصا للأسرة، كالزوج مثلا يأمر زوجته ببعض العمليات حتى يعني يقوم بالاستمتاع بها، أو بين الإخوات داخل الأسرة لضرورات معينة قد تظهر بين الأسرة، فحكم إن شاء الله الشرع في العمليات التجميلية لهذه الضرورات بإذن الله. جزاكم الله خيرا.
الله يجزيك خير. تفضل.
هل من مثال على الضرورات حبيبنا بين الأسرة، بس حتى أفهم الله يكرمك، هل من مثال على الضرورات بين الأسرة؟ يعني معذرة أخي ما فهمت.
قد يكون الزوج يريد أن يرى في زوجته شيئا معين فيأمرها بعمل تجميل في جزء من أجزاء جسمها حتى يشبع رغبته فيها بدل من أن ينظر خارج البيت. مثال.
جزاك الله خير.
هذا صاحبنا الذكر بعد أمتنا.
السلام عليكم ورحمة الله وبركاته. أعتذر المشاركة مرة أخرى، ولكن هناك موضوع مهم أنا نفسي أريد أن أتعلم عنه من أهل الخبرة والاختصاص وإخواني ومشايخي والعلماء إن شاء الله تعالى، وهو أبدأ بهذا القصة القصيرة. أنني دعيت إلى الرهاب سنتر لزيارة أحد الأمريكان الذي عنده مرض السرطان، وزرته وكان رجل يتكلم معي بكل طلاقة ووجهه في الحياة والصحة. وبعد اليوم الثاني دعوني إلى دفنه، إلى جنازته. فهناك حاجة اسمها الموت المريح، نريد أن نتعلم عن أحكام الإسلام تتعلق بهذا الأمر إن شاء الله تعالى. أمر آخر وهو أريد من الإخوة المشايخ الباحثين إن شاء الله تعالى أن يعلمونا الترمينولوجيز والكلمات الكلمات التي يعني تعبر عن إيه؟ عن القضايا الطبية. يعني مثلا كازماتيك سيرجري، هذه الأشياء إحنا العرب لا يعرفونها، فنريد أن نتعلم هذه الترمينولوجيز إن شاء الله تعالى. فنرجو من الأخوة الباحثين يعني اقتراح مني أنهم يركزوا في بحثهم على التعريف بهذه المصطلحات حتى نتعلمها ونفهم من يسألنا عنها إن شاء الله تعالى. في نفس الحال برضو الإخوة الذين يعرفون اللغة الإنجليزية سيعرفون المقابل من اللغة العربية حتى يستطيعوا أن يساعدوا الإخوة العرب إن شاء الله في الجالية. والله أعلم. جزاكم الله خير.
تفضل شيخ. Are you next in line? Okay. Okay.
السلام عليكم. مش أكثر من تعليق السؤال إن شاء الله. تعليقي المؤتمر الماضي تكلمنا عن الإلحاد، واليوم نتكلم عن مشاكل التكنولوجيا. قد يكون في علاقة ما بين الموضوعين، ولكني تكلمت مع الدكتور وليد في هذا الأمر. نريد أن نتعلم كيف نتفقه ولا نتعلم كيف تعطونا فتاوى. نريد أن نتعلم كيف نفهم الفقه، أساسيات الفقه. هذا يقلل من المناقشات الطويلة التي تتردد دائما، ونكون على وضوح بأنفسنا كدعاة. نكون بسهولة ندي آراءنا للناس من غير من نروح نقضي وقت طويل في المناقشات هنا. وقضايا الشباب أنا أعتقد أن هي أهم شيء الزواج والطلاق، واقترح ان كل واحد يجيب معاه من السنتر بتاعه شاب من الشباب ونتفاهم ايه المشاكل، لان الالحاد ما زال هو ما يضر الامه الان في بلاد المسلمين وفي غير بلاد المسلمين. والقضايا اللي ناقشت في هذا المؤتمر منها ما يؤدي الى الالحاد. يعني تخيل الشباب عن الميتافيرس والهولوجرام والكابابيلتي بتاع التكنولوجيا العاليه جدا تقود الشباب من ناحيه الالحاد كعلوم متقدمه وينبهروا بها وينشغلوا بها وينصرفوا عن المساجد. جزاكم الله خيرا. بارك الله فيكم.
الله يجزيك خير. بارك فيك. Sisters, do we have any? Yeah. Okay.
Okay, so just a couple more that came up was receiving care from can you hear me?
Yes.
Receiving care from like a physician of the opposite gender. So yeah, in terms of like medical treatment, and then for males and females using like a sperm donor or being a surrogate mother. I think test tube babies was mentioned, IVF, but like specifically in the discussion of IVF, like what the gender of the doctors.
May I interrupt you, please? So I got the first point, receiving care from opposite gender. What's the second one?
The second one was like for men, like being a sperm donor, for women being a surrogate mother, and then specifically going back to like contraception between like forms that are like temporary, like say IUD or the patch or the pill versus permanent, like for men vasectomies or for women sterilization or, you know, getting tubes tied, yeah. And then also like specifically, I don't know if this would fall under the same category of using like pig products in medicine, but maybe like a transplant from a pig valve for a human heart transplant. So not like medicine for consuming, but like also like physically in your body. And then same as in using that for vaccines. Yes. And there's...
أنا يعني أستأذنك يا صادق. أنا I have to go to catch my flight, so جزاكم الله خير. أريد أن أشكر لكم حضوركم ويعني الحمد لله استفدنا من هذا اللقاء، وأوصي يعني الأئمة وإخواني بالحرص على هذا اللقاء كل عام، وأوصي الأطباء من الحاضرين. عندنا الدكتور أبو زيد، يعني المهمة في المؤتمر القادم كبيرة على عاتقك، والدكتور أحمد متولي وكذا يضي، يعني حتى لو ما ذكرتم شيء من المسائل الآن، please make sure that you contribute to the topics. You guys in the field, you know, we're looking for a very rich conference, inshallah, next year. Thank you very much again. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalam. Tafadhal, Sheikh.
So if this is primarily a competition of spirituality and ideas, and if we can, when we present the topics, if it's possible to present them from an inquiry-based approach, like what is the challenge that this problem that we're trying to address, and what is the connectivity both spiritually and intellectually, not just from perhaps the legal perspective, so that we can have a toolkit on how to grapple with the issue. Because perhaps my observation is wrong, a lot of the topics are presented that this is the legal position, and which is fine, but more an inquiry-based approach in between helping us understand the underlying reasons. Because an inquiry-based approach will help us convince the next generation, and Islam is unique as an intellectual force that it can solve the problems of even people who are not members of the faith. And an inquiry-based approach can help us make intellectual space in the public space to say that Islam is relevant in our modern time because of this inquiry-based approach.
Can I ask for a practical example, even if it is brief, please?
Okay, a practical example is like, for example, riba. If you talk to a non-Muslim and tell them you don't engage in interest, they get confused. But if you tell them that you should not be able to make money on something that that the bank is not risking anything, they're loaning money that's not even theirs, you should not be in debt for 40 years, then all of a sudden the person says, yeah, this is an interesting economic idea. I see why even Christianity fought against riba for 600 years. So that type of framework, the average non-Muslim can agree with you then on riba, because the average non-Muslim is also in debt.
So do you expect us to come up with a justification regarding the Islamic ruling, why Allah subhanahu wa ta'ala prohibited riba, and explain it in a contemporary language that fits and understandable for non-Muslims? Is this what you want?
Okay, this is actually very good, but yes, that it would be, because riba is forbidden, but their intellectual reasons is forbidden. Their spiritual reasons it's forbidden, right? And when you frame it like that, the average citizen is generally inclined to agree with you unless they're in the banking sector, right? And so this is what we want to do. We want to frame it in a way that the average citizen says, you know what? This prophet was onto something here. That this is totally in line with my essence as a human being, right? Because that's what Islam does. Islam spiritually puts the guidelines of Islam put us in the essence of our true nature.
Understood.
And I think that's what, because what I've observed, perhaps in my observation, is a lot of the focus is on the legal interpretation. And that has value, but I think as we move to mainstream in the next generation, it has to be inquiry based.
Jazakallah khair, I understand. Thank you.
Jazakallah khair. Next.
Assalamu alaikum. Two suggestions, Mashaykhna. The first one is about Muslim physicians who are treating sometimes non-Muslims and prescribing whether it is medicine or some procedures that may be haram for Muslims. What's the threshold for Muslim physicians working in the field? This is the first one. The second thing is about so many masail that our fuqaha, they based on the opinion of physicians back at that time. Now we discovered so many updates that this is not valid anymore, and this has been used as misconceptions against Islam. So whether this can be included in the conference or not, this masail that was merely based on the physician decision or a decision coming from medical perspective.
I didn't get the second point. What is it that you're trying to address?
So some masail, the scholars or the mujtahidun or fuqaha back in the day, they based the hukm based on the physician's opinion or the decision coming from decision. Now we discover this is not the case anymore, and this is being used against Islam sometimes or against Muslims. Can we include this in the topics?
Okay. No talking from the, please. تفضل الشيخ أحمد.
Assalamu alaikum warahmatullah. Ahmed Nasser from Brooklyn, New York. Alhamdulillah, last year Mishka student. Jazakallah khair Fadilat al-Mashayikh for all their efforts, and may Allah subhanahu wa ta'ala reward them. Ameen. The topic suggested is cosmetic surgeries and their parameters. Surgeries that were once known to be purely cosmetic, but now have proven to actually have medical benefits, such as, for example, liposuction. Jazakumullah.
Next, Sheikh.
Assalamu alaikum wa rahmatullahi wa barakatuh. May Allah bless and reward all of our scholars and esteemed imams and guests. That being said, end of life, when to pull the plug. Medically induced comas, however long they last, short or long, what happens to the prayers that need to be made up or not? And lastly, when someone is in hospice and they are using marijuana or given that as an option. Thank you.
Sisters, do you have any suggestion?
Yes. Assalamu alaikum wa rahmatullah.
Can
Can you hear me better like this?
Yeah.
I have a few topics.
Sure.
The first one may be like a ruling or guidelines to people or persons who are psychologically challenged, and I guess sort of differentiating who needs ruqya and who needs medicine and how to go about that. Another one, especially nowadays, there's a lot of new sanitary products for women that are coming out that maybe weren't.
I'm sorry, I did not get the last sentence. Can you repeat it, please? So we talked about guidelines for psychologically challenged individuals.
Yes, those who need differentiating who needs ruqya and who needs medicine.
Correct.
The second one?
The next point, the use of sanitary products for women, like cups, menstrual cups, menstrual absorbing undergarments, tampons, and stuff like that. And then my last suggestion is about a woman who is maybe not currently married, but she is afraid she may not get married by the time she can have children, and so she wants to freeze her eggs. So freezing her eggs in order to have children later in the future or via surrogate.
For the use of sanitary products for women, you mentioned the tampon. What else? What are other examples?
Menstrual cups and menstrual absorbing undergarments like underwear.
Exactly. تفضل شيخ.
Assalamu alaikum wa rahmatullahi. First, I just want to say Jazakallah khair to everyone in the AMJA team and set up an amazing weekend. There was a lot of benefit, alhamdulillah. And Jazakallah khair also to the Mashayikh for the amazing research and the amazing topics that they discussed. I just want to say may Allah subhanahu wa ta'ala give all of you and your loved ones the best in this life and the next, inshallah. But the two topics that I wanted to see, inshallah, discussed next year is one of them is particular to medical students. So those who are going through the medical field, and there's a lot of unavoidable harm that happens in the medical fields. For example, it's almost impossible to be able to get through the entire medical school without taking loans, or having to do with human cadavers, or while you're doing your medical school and internship and even residency, having to dabble in fields that may not be permissible. So like a man needing to dabble into the OBGYN field. So what is the permissibility and the discussions around those? And the second thing has to do with addiction, particularly for those who are sincere and trying to get off their addiction. For example, in extreme cases like heroin, going cold turkey, cutting it off completely at once, can cause a lot of harm and even death. It's almost encouraged sometimes that they would take smaller doses of whatever they are addicted to kind of slowly wean them off that drug or off that whatever addiction they have. So during that process of them being weaned off, when they are still taking those small doses, would they be held accountable in terms of sin when they have that sincere intention of eventually getting off completely? Jazakallah khair.
Next.
السلام عليكم ورحمة الله وبركاته. جزاكم الله خيرا الكرام وجميع الحضور. العلاج النفسي بالطرق المختلفة سواء باليوغا أو بالموسيقى أو بجلسات التأمل، وأثرها بدأ يظهر الآن أثر جلسات التأمل حتى على أخلاقيات من يحضرون هذه الجلسات. فأعتقد هذا من الأمور الهامة. وكذلك استخدام المواد أو الأدوية في العلاج النفسي، بعضها له أثر يعني بعيد الأمد. فاستخدام الأدوية المختلفة بما فيها أيضا الماريجوانا والسي بي دي وحكم ذلك من الأمور التي يقوم بها الناس في التجميل إزالة الشعر نهائيا، وخصوصا يعني نريد البحث في مسألة إزالة الشعر للرجال. هناك من يزيل اللحية مثلا نهائيا، أو يزيل أماكن معينة أو أجزاء معينة من اللحية وغيرها نهائيا، أو يزيل شعر الجسد أيضا. أيضا مدى أهمية أو فرضية أو حكم جعل المساجد هانديكاب accessible أو هانديكاب friendly. يعني ما حكم هذا الأمر بالنسبة لنا كمسلمين؟ هل هذا أمر حكمه بالنسبة للحكم الفقهي في هذا الأمر؟ وأيضا كيف تكون المساجد مناسبة للصم والبكم وغير ذلك؟ ما هو الحكم في ذلك؟ جزاكم الله خيرا.
I just want to make a very quick comment here. I highly recommend our brothers and sisters here to go to our website and to check AMJA declaration. Go to amjaonline.org and then there's a tab called declarations. Click on it. It's going to show you all the official positions of AMJA since maybe 2001, 2002. A lot of questions and concerns that have been raised today already tackled, researched, and we do have our official position. Just a random example is the student loan. We did actually discuss this issue a while ago, and we have a very official position have been posted there for a while. We did differentiate between the subsidized loan and the unsubsidized loan and so on and so forth. So please go to our website and read more about the official declarations of AMJA in the past. Jazakumullah.
Assalamu alaikum wa rahmatullah. I think it was mentioned earlier, psychological disorders, but just to expand on that, mental health disorders in general, specifically when it comes to OCD diseases, scrupulosity, and the preventions that it, the handicapping that it causes to the patients, preventing them from praying or making them repeat their wudu multiple times to a point that it stops them from going on with their day. If we can have a statement about that, that would be phenomenal.
Two questions. One that I think, when it comes to those who are practicing medicine and prescribing medicine, and you know that a doctor may know that a certain prescription medicine may not work as well as a non-prescription medicine, what is the ruling for him prescribing an approved medicine that is prescription versus non-prescription medicine that may work better for the patient? The second thing
so you're saying that the doctor has two options, but he's going with the less effective solution for whatever reasons or insurance limitations?
Like some of the prescription medicines have known side effects, but because it's part of the accepted system, this is what doctors normally prescribe for this situation. For example, aspirin or Tylenol, which has a known side effect. He may know another medicine that achieves the same effect without the side effect, negative side effect. So, what is the ruling on that? And so that's one issue about prescribing medicine. The second thing is that we are being imposed upon with the idea of multiple genders. So as doctors, how do we handle when someone comes to us as a patient and says that I want to be treated for my gender dysphoria, I want to go for gender change operation? So how do doctors handle that situation? Jazakumullah khair.
Jazakallah khair. تفضل شيخ.
بسم الله الرحمن الرحيم. زكريا عبد الحليم من مركز الجالية الإسلامي لإلينوي ICCI. الحقيقة أود أن أشكر حضوركم وأقول سعدت شيكاغو بقدومكم وازدانت بحضوركم وتباركت بطروحاتكم صدقا، ولهذا انعكس الأمر على الحضور في قاعات المحاضرات. والشيء الآخر الذي أود أن تناقش قضية الهانديكاب والأحكام المتعلقة سواء بالعبادات أو بالنقل أو بالمواصلات لمسألة الهانديكاب وأحكامهم من جميع الجوانب. بارك الله فيكم.
Sisters.
Yes, we have a few more suggestions from the sisters. So one was using like psych-altering drugs for medical purposes, like LSD and others.
Using what again?
Like psychedelics, like psychologically altering drugs for medical and non-medical purposes. So like LSD and similar drugs in that category, like ketamine. And then if someone is born with something that, you know, could be considered a defect, like a cleft lip or someone that has shorter limbs, can you do like limb lengthening surgery or, you know, address the cleft lip? Or if someone, you know, just wants to get crowns in their teeth for aesthetic purposes, or maybe they have crooked teeth, surgeries for that. I think maybe laser hair removal was already asked, but maybe like Botox and liposuction. Those were additional questions.
So how to differentiate between whatever is a cosmetic surgery versus whatever is necessary? Is that correct?
Yeah, I think both, both those. And where I guess the line is drawn, and how do they find that line?
Yeah, no. تفضل شيخ.
بسم الله. السلام عليكم ورحمة الله وبركاته. جزاكم الله خيرا for this great discussion, and we really benefit and we appreciate it. I would like to suggest two things. One, there is an opioid crisis, as you know, and drug abuse in general in our community, especially the youth and the college students and maybe other people. So the opioid crisis is killing our youth a lot. So if we discuss next year, you take opioid and you die, you kill yourself. So it's kind of suicidal because they know they're going to die, and we are losing a lot of youth. So. And the way I see is there's a rehabilitation and all these things, but it's not stopping. But if we tell the youth, if you take your soul, there's a punishment for that in the hereafter. The second part of this suggestion is there is a business called a group home. Group homes. Group home provides services the people who dealt with drug addiction. And they are mentally illness, they cannot control themselves anymore, but they are using them, giving them more drugs and more services, so they keep in business. So they're not helping. So the way I see is brothers and sisters who need those services, they are not, there's no way out. They're getting more sickness, and basically they are doing for a business. So also I would like to discuss that issue. The Muslim brothers and sisters who has group homes, and they give it more medication and more drugs in order to get the more hours and the more services, and also there is no any benefit for the beneficiary. Thank you.
We have 6 minutes left, so we're going to take only the whatever 4 left, inshallah, and one of the sisters. Go ahead.
Assalamu alaikum. Since the time and the place of the conference, sorry we go out of the topic, about the time and the place of the conference. If it's already chosen, can we consider in the future to have the conference during the weekdays? Most of the audience are Imams, and when we come Friday, Saturday and Sunday, all of our masajid are deprived from weekend school and the Friday Jummah, or we come and miss. So is it a possibility that you can consider in the future to have the conference during Monday, Tuesday, Wednesday, whatever, to give us a chance to serve our masajid and our community?
جزاك الله خير. تفضل الشيخ أحمد.
السلام عليكم ورحمة الله وبركاته. مسألة ضمان الأطباء للأخطاء التي تحدث عند العمليات الجراحية نسأل عنها من الأطباء، ونريد يعني أن نكون على بصيرة وبينة إن شاء الله من الأحكام التي تتعلق. ومرة أخرى يعني أريد من الإخوة المشاركين الباحثين أن يطلعون على ما جد في هذه الأمور إن شاء الله. لا شك أن الدكتور بقى محمي بالقانون، ولكن الأحكام الشرعية نحتاج عندما نسأل إن شاء الله أن نعطي فيها يعني الحكم الشرعي على حسب الدليل إن شاء الله والبينة والبرهان. الأمر الآخر هو مسألة مسألة الأبورشن بلا شك أن هذه المسألة اللي هي الإسقاط الجنين هذه المسألة بحثناها ودرسناها وعشناها في الأيام الماضية، ولكن نريد أيضا من إخواننا المتخصصين أن إن شاء الله يطلعونا على أي شيء جديد فيها إن شاء الله تعالى. جزاكم الله خير.
Sisters, do we have a final comment? No? Go ahead. Can we give the sister the mic? Who has the mic for the sisters?
Yes, there's one more question.
Okay, there's a sister who actually to the left. Oh.
Yeah, it's the same question.
Okay.
So using alternative therapies from like other cultural practices or maybe religions, but taking out the religious aspect.
An alternative therapy of?
For example, energy medicine, something like that comes from another culture that may, possibly have like a different cultural or religious sort of background, but you're removing that aspect and using it for its medical purpose. Maybe acupuncture or something similar. Chinese medicines.
طب جزاك الله خير. تفضل شيخ.
Assalamu alaikum. Jazakumullahu khairan everyone. May Allah accept from all of us. Ameen. I have two issues to request that they be addressed, inshallah. Number one, if AMJA could address the conventional approach on how medical doctors are trained in following protocols like prescribing drugs and medicines with many side effects, C-section rates, etc., while neglecting nutrition, sleep, exercise, versus the holistic approach with natural medicine and those that are mentioned to us through the Quran and the Sunnah, such as hijama, asal, so on and so forth. Just as a Muslim doctor, if somebody approaches you, should you be addressing these things? And overall, as Muslim physicians, should we be talking about these things more often with our patients? And we see quite a bit of a lack of it. The second issue is pertaining to MMA, mixed martial arts, jiu-jitsu, etc. Just to make a touch upon the medical field, there are a lot of practitioners, but there are fatwa out there mentioning that, a blanket fatwa that it is just haram. Even wrestling, there are fatwa out there that wrestling is just haram when we know it's from the Sunnah.
I'm sorry, what is the haram?
Mixed martial arts, wrestling, boxing, etc.
But that's not medical, right?
So how I was trying to tie it in with the topic regarding medicine and doctors and physicians is that they see these and they talk about these, that if they're practiced in a safe environment, then they should be safe to practice. In other words, if people practice it safely, it doesn't have to be haram. So from a medical perspective, from a safety perspective, a health issue, how do we address it when we know many people who practice these arts? Of course, there's a hadith about hitting the face, but if it's practiced in a safe manner, such as wearing headgears, etc., a lot of the youth are getting into this, but a lot of the people from the older generations, even the mashayikh, they just have a blanket rule. They just say, don't do this, it's haram. So it would be great if the ulama could address this and clarify the issue, inshallah.
Allah barik lak. Jazakallah. Allah barakallah fikum, mashallah. It's a long list of topics, and mashallah, they are very good ones. So inshallah, now we're coming to the conclusion of this conference. We have 1 minute. Inshallah, we're going to end it with a dua from one of the mashayikh. My apologies, rushing on time. Inshallah, we gonna hear from the mashayikh, Dr. Zuhaili, just 1 minute. No. We're gonna hear from three the mashayikh based on the Dr. Salah request. Just their address to the audience. Inshallah, you need to get it close.
Alhamdulillah Rabbil Alameen. والصلاة والسلام على رسوله محمد وعلى آله وصحابه أجمعين. Respected fuqaha, shuyukh and imams, I am really very pleased to be here and to learn so much from all of you. And it really reminds me about the story of Ibrahim alayhi salam, who was raised and grown up in Iraq. He spent so much time in Iraq. Then he moves to Syria, Bilad al-Sham. Then he goes to Egypt. Finally, he comes to Makkah al-Mukarramah. And there he is appointed the Imam leader. When Ibrahim al-Islam became the leader, he does not look back to Iraq, Syria or Egypt. Iraq was a developed country, but he does not want to borrow the ideas of Iraq, ideas of Syria, ideas of Egypt to Makkah al-Mukarramah. He starts a new life, makes a new center, has a new vision, and looks for the future. And he makes Makkah a center for the future generation. Mostly what happens when our Imams, leaders come from Egypt, Syria, Iraq, India, they want to copy Azhar, they want to copy Indian madrasas in the West. But what I've seen here, alhamdulillah, I really am pleased that the fuqaha who are sitting here, though they are born in Egypt, they are born in Iraq, they are born in Syria, they are raised up there. But actually, when I listen to their speeches and their buhuth, I realize really, it seems to me as they are born here. They were born in a time when there was no social media. But when they discuss all these issues, it looks like they are actually people of the contemporary issues. So this is what leadership means. That whenever we are anywhere, we don't look backward, don't look to our countries, don't copy Azhar, don't copy Indian madrasas. What we need to understand is this is our homeland. We should treat really as we are born here, as we are grown up here. The issues of this land are our issues. We need to lead the people here. We need to look for the future of the people of here. If we do this, then we are Imams, then we are leaders, then we are fuqaha. But if we keep looking backward, keep copying all the models of India, Pakistan, Bangladesh, Egypt, then we are not leaders. Leadership will belong to the people who understand their homeland and who look forward. So alhamdulillah, I was really happy and pleased to listen to these buhuth and tahqiqat and learn from them. And I'm from Europe, from England, and inshallah I hope to follow our mashayikh, their vision, inshallah, same way back in England and to learn from them, inshallah ta'ala.
Allah يجزيك خير فيك.
السلام عليكم ورحمة الله وبركاته. وبعد أيها الإخوة كلمتان. الكلمة الأولى رب العالمين يقول وأما بنعمة ربك فحدث. هذه النعمة اجتماعكم، وأن اجتماع 400 إمام من أمريكا وكندا هنا، ليس في مكة ولا القاهرة ولا بغداد ولا دمشق، فهذا نعمة كبرى وامتداد. ولا أريد أن أكشف سر أن هناك قوى عليا فرضت على البلاد العربية فيما أعلم قطع ينابيع الفكر والفقه الإسلامي، وقطعت الإعانة على مجمع فقهاء الشريعة، ومنذ 5 سنوات لم نجتمع، وإنما استمر اجتماعات الأئمة، فهنيئا لكم. الموضوع أيضا اختيار موضوع التواصل الاجتماعي أهم موضوع في القرن 20، ولا يوجد كلمة منه لا في الأم للشافعي ولا في الكاساني ولا في ابن قدامة ولا في قاضي عبد الوهاب، كله الآن وخطره كبير من الأطفال والشباب والكبار. النقطة الثانية وهو أيها الإخوة أنتم الدعاة، فأحذركم من الجراثيم والمكروبات المعاصرة القاتلة التي وصلت للعالم الإسلامي وتصل أحيانا لبعض الأئمة، أحذر منها. ومنها الغلو في الدين، التعصب المذهبي، الدعوة للفرق المنهدمة، نبش قبور بدءا من العائشة وحتى الدولة العثمانية، أبو بكر عمر عثمان معاوية، حتى كلب يقول أنه صلاح الدين كان الأسطورة، وأن الإسلام والعرب لم يدخلوا مصر إلا في القرن الرابع. في العهد الفاطمي، هذا على قنوات. أقول يعني احذروا من هذا، نبش القبور والكلام عن الماضي والتاريخ، الفرق المخربة والمقسمة، الصوفية، السلفية، الاعتزال، الأشاعرة، كل هذه كلام يا أخي مفرق، ولم يعرف لا ابن عمر ولا الجيش الإسلامي ولا غير ذلك. فأنتم الآن اجتنبوا، كل واحد يعتقد صوفي، معتزلي، أشعري، سلفي، حنفي، شافعي، يعتقد ويتابع اللي بده إياه، ولكن عدم إثارتها فيما بينكم من جهة وبين الناس، والحمد لله رب العالمين.
الله يجزيك خير. دكتور موفق تفضل.
السلام عليكم ورحمة الله وبركاته. الحقيقة ما كنت أود أن أتكلم، لكن بعض الأخوة الأئمة الفضلاء قال يعني حبذا لو تحدثونا كيف يطور الإمام نفسه فقهيا وما إلى ذلك، فأثار شجوني في الحقيقة. يا إخوة، أيها الإخوة الأحبة، أنتم على ثغر من ثغور الإسلام. عندي الحل بسيط جدا وبفضل الله أنا أقوم به. أنشئوا دروسا للكبار والصغار، للرجال والنساء. زكاة العلم بذله، فأدم للعلم مذاكرة، فزكاة العلم مثابرة. كل شيء بالبذل ينقص إلا العلم، كلما بذلته زاد. فأنت تحضر الدرس تزداد، تعطي الدرس تأتيك أسئلة جديدة تراجعها تزداد علما، وهكذا. أما كما تفضل فضيلة الشيخ صلاح أن توصد الأبواب وتكتفي بالجدول. يعني أعطيكم مثال عملي. أن هل يجب للإمام أن يكون له ويكند ويكون ساكن جنب المسجد ويقول هذا اليوم أنا ويكند ما أجي على المسجد؟ يا أخي هذه رسالة، أنتم ورثة الأنبياء، كيف لا تأتي للمسجد؟ نعم هناك فسحة، هناك فرصة، هناك كذا، لكن الرسالة أعظم من ذلك. حتى لو أخذت أنت إجازة أينما تذهب أنت نور، أنت ضياء، أنت ظل للمسلمين، أنت درء للمسلمين، أنت عود للمسلمين. فاعرفوا قدر أنفسكم، العظائم كفؤها العظام كما قال الشيخ مصطفى السباعي رحمه الله. فعلى قدر أهل العلم، على قدر أهل العزم تأتي العزائم، وتأتي على قدر الكرام المكارم. فاعرفوا أنفسكم وقدر أنفسكم، طور نفسك بهذا، مزيد من الدروس والبذل والعطاء، فيزكو علمك وتطهر، تلقى الله عز وجل راضيا مرضيا. جزاكم الله خيرا والحمد لله رب العالمين.
الله يجزيكم الخير ويبارك فيكم. فضيلة الدكتور صلاح تختموا بالدعاء.
بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. اللهم إنا نسألك خشيتك في الغيب والشهادة، وكلمة الحق في الغضب والرضا، والقصد في الفقر والغنى. اللهم إنا نسألك نعيما لا ينفد، وقرة عين لا تنقطع. اللهم إنا نسألك الرضاء بعد القضاء، برد الحياة بعد الممات، لذة الشوق إلى لقائك، نعمة النظر إلى وجهك الكريم في غير ضراء مضرة ولا فتنة مضلة. اللهم زينا بزينة الإيمان واجعلنا هداة مهتدين. اللهم أرنا الحق حقا وارزقنا اتباعه، وأرنا الباطل باطلا وارزقنا اجتنابه. اللهم اختم لنا بالباقيات الصالحات أعمالنا. اللهم اخلف كل من بذل لإنجاح هذا المؤتمر بمجيئه، بحضوره، بماله، بجاهه، بصلاته، بعلاقاته. اللهم عوضه عما بذل عافية في بدنه، سعة في رزقه، صلاحا في ذريته، سكينة في نفسه، طمأنينة في قلبه، حسنا في خاتمته. إنك ولي ذلك والقادر عليه. اللهم آمين. وصل اللهم على نبينا محمد وعلى آله وصحبه وسلم. سبحانك اللهم وبحمدك، أشهد أن لا إله إلا أنت، أستغفرك وأتوب إليك.
جزاكم الله خير بارك الله فيك. إن شاء الله الآن we're gonna take the صورة الجماعية يا شيخ Abu Tammam. Inshallah, we ask all the Imams, inshallah, to come to the front just for one picture, inshallah.
أنا عايز أخد بيكشر مع الميكروفون.
وليد المفتي اهلا وسهلا اهلا وسهلا.
الناس كتير ماشي.
بخير.
حتى مع الستيج مش هيوسع كله.